Guys, number 13. During dynamic observation of a parturient woman in the second stage of labor. Second stage of labor, usually fetal heart, fetal head in the cavity. Yes, second stage. It is expulsive stage. That the fetal heart rate fell down to 90 and 100 and did not come to normal after contractions of the uterus, they mean. Vaginal examination revealed the complete cervical dilation, fetal heart filling the entire posterior surface of the pubic symphysis and sacral hollow. Sagittal suture light in the anterior posterior diameter of the pelvic outlet. Here you see they told you that anterior posterior diameter. Indirect diameter, you remember indirect diameter with the pelvic inlet, yes, or anterior posterior diameter of the pelvic outlet. It is the same. The posterior fontanella was in front under the pubic arch. What plan for further labor management should be recommended? Of course, it is, you see here, yes, application of forceps minor. Yes, you see here, do you remember I explained you? Maybe it was forceps using of obstetric forceps, maybe application of the forceps minor. Forceps minor, it means outlet forceps or low forceps, and it is the right answer, yes, because fetus head is on the pelvic floor. Because what show us this? Sagittal suture in the anterior posterior diameter of the pelvic outlet and posterior fontanella in front under the pubic arch. Yes, fontanella under the pubic arch and anterior posterior diameter correspond to the sagittal suture. It is pelvic floor. Fetus head is on the pelvic floor. And application of forceps minor, it is the right answer. Caesarean, impossible, because fetus head in the pelvic cavity. Episiotomy don't give us any effect, yes. Application of cavity forceps, no, because the fetus head on the pelvic floor. Cavity forceps, it is high localization of the fetus head, and usually, guys, if the fetus head is in the cavity in the wide or narrow part, they gives you that sagittal suture in oblique diameter of the pelvic, in oblique diameter, yes, not anterior posterior, but usually sagittal suture and oblique diameter. It means that fetus head in the cavity of the pelvis. Stimulation of labor activity, only we can aggravate the condition of the fetus because we have severe distress. Yes, bradycardia, the fetus have lost opportunity to compensate this distress, this decrease of oxygen. The next, number 14. 10-week pregnant woman was admitted to a hospital for recurrent pain in her lower abdomen. Blood discharges from the genital tract. The problems turned up after IRVI infection. Yes, the woman was registered for antenatal care. Speculum examination revealed cyanosis of the vaginal mucosa. It is the normal for the pregnant woman. Clean cervix. Clean cervix means that there is no any pathological changes of the cervix. There is no any pathological formation on the surface of the cervix. Open cervical canal discharge blood and blood clots. The lower pole of gestational sac was visible. What tactic should be chosen, guys? What happened with this woman? What diagnosis you can set here? You are quite right. I want to see who answer me. Yes, who answer me? Маханти. Так, Маханти also very active. Так, it is, you're quite right, abortion in progress, and we cannot save this pregnancy because what? amniotic sac separated from the wall of the uterus and appear in the cervix. That's why how we can stop this bleeding and help the woman only remove this feeder together with the chorion. Yes, it is only 10 weeks. There is no placenta. That's why we perform curettage of the uterine cavity. Maintaining the pregnancy, it is impossible. If we wait, expected management, woman can die due to blood loss. Hysterectomy for young woman, no evident signs to do this. Yes, only if it is strict indications. We don't do hysterectomy. Так, сейчас, ребята, так. Antiviral therapy tool, it is no sense in this, and no sense to explain even. Number 15, 30 years old multigravida has been in labor for 18 hours. 2 hours ago, the pushing stage began. Yes, it is a second stage of labor. Fetal heart rate clear, rhythmic 136. Vaginal examination revealed complete cervical dilation. The fetal heart in the pelvic outlet plane, in the pelvic outlet, yes, on the pelvic floor. Sagittal suture in the line with obstetric conjugate. I told you, obstetric conjugate, it is the anterior-posterior size of the pelvic inlet, anterior-posterior. They told you that sagittal suture in line with this obstetric conjugate. Yes, in anterior-posterior size, it means of the pelvic outlet. The occipital fontanelle near the pubis. Patient has been diagnosed with primary uterine inertia. What is the further management? Yes, labor management. No, if she has primary uterine inertia, guys, I told you that in this test it is really mistake. I don't agree with this. It can confuse you, but they think if it is primary uterine inertia, it will be inertia from the very beginning of labor. But you see that woman, or it is the mistake of the doctor. It cannot be primary uterine inertia because in this case, fetus head cannot be on the pelvic floor. At least all fetus head pass all way to the pelvic outlet, and then it was diagnosed primary uterine inertia. Secondary, of course, I agree with this. It is secondary uterine inertia. It happened if we have some period of good labor activity and suddenly labor activity stopped. Yes, not stopped. It's present, but there is no productive labor. It is secondary uterine inertia, of course. Here mistake we have, but of course, if it is inertia, we need to apply outlet forceps. Yes, labor stimulation. In this case, prolonged labor, no, it's occupy a lot of time, needing time, stimulation of labor. Cesarean section impossible, skin head Ivanov not used today, and vacuum extraction of the feature may be possible. But if you have vacuum extraction and outlet forceps, you choose forceps, because vacuum extraction in our countries is not so popular, but it is also right answer, I want to say. Number 16, multigravida at 39 weeks of gestation has been delivered to hospital having an regular labor activity for 8 hours. The water burst an hour ago. They means amniotic fluid. She complains of headache, seeing spots, BP 180 to 100, urine test results, protein 3.3, hairline cylindrous, fetal heart rate 140 rhythmic. Vaginal examination revealed complete cervical dilation. The fetal heart is on the pelvic floor. Head is on the pelvic floor. Sagittal suture is in line with obstetric conjugate. Again, yes, it means that sagittal suture in anterior posterior size of the pelvic outlet. The occipital fontanella is under the pubic. Yes, fontanella usually under the pubic every time. What is the optimal management of labor? And they suggested you outlet forceps, cavity forceps, Tesaré, vacuum extraction of the feature, and conservative management of labor. What we have here, what condition, guys, who can set the diagnosis? What?
Preeclampsia.
Guys, no, here not, we have preeclampsia, yes, but preeclampsia 180 to 80, but we have protein in urine, yes, it is middle preeclampsia, but I told you, if the woman has headache and disorders of vision, it can finish with eclampsia. Yes, disorders of vision, it is severe symptoms because one of the symptoms of a beginning of edema of the brain, and that's why it is severe. You know that it is the last the end of the second stage of labor because fetus head is on the pelvic floor. Yes. And that's why it is what outlet forceps in order to accelerate the labor and prevent development of eclampsia. It is preeclampsia, but maybe eclampsia because we have very severe symptoms here. The next. Так, and maybe так, the next. Сейчас. Outlet forceps. Woman, 30 weeks of pregnancy, had attack of eclampsia at home. On admission to the maternal ward, BP 150 to 100. Predicted fetal weight is 1 kilogram and 500 grams. The face and shins are pasty, no, edema, they mean. Urine protein 0.66 gram in a liter. Birth canal is not ready for delivery. An intensive complex therapy has been started. What is the correct management in this stage? Guys, if you see in test it was eclampsia, of course, you need to finish labor in any age of pregnancy with the help of cesarean section. If it was eclampsia, we don't wait because it can finish very dramatically. The next, the 26 years old pregnant woman was admitted to a hospital for abdominal pain and bleeding from the genital tract. Bimanual examination revealed that uterus was in the size of 9 weeks of pregnancy. Cervical canal let a finger through. Fetal tissues could be palpated in the orifice. There was moderate vaginal bleeding. What is the tactic of choice? Again, what we have here, guys? Abortion in progress, yes, because cervical canal let a finger, fetal tissues could be palpated in the orifice, they mean cervical os, yes, and of course, we need to perform instrumental extraction of the fetal tissues, yes, or maybe they write you here curettage of the uterus. It's also right answer, yes. Other points, it is at all impossible in these cases, guys. And we miss the topic female urogenital inflammatory diseases and diagnostic and treatment. Now we have a time for this. Yes, if our time finish, we finish our classes, and you know that on Monday we will begin at 10 o'clock because we have meeting on the department and I have no opportunity to be with you. That's why at 10 o'clock we begin, and we begin to discuss the topic disorders of the menstrual cycle and neuroendocrine syndromes. I told you about it. A test in KROK present devoted to this topic. That's why we need to pay attention to some moments of these disorders of the menstrual cycle. Now, inflammatory diseases. 40-year-old patient complains of yellowish discharges from the vagina. Bimanual examination, no pathological changes. This may contain Trichomonas vaginalis and blended flora. Colposcopy. Colposcopy, I hope you know what does it mean. Investigation of the cervix with the help of colposcope, which we put, it looks like as microscope. Yes, we put to the entrance to the vagina, relate it to the walls of the vagina and see the condition of the mucosa of the vagina and condition of the vaginal part of the cervix with the help of this microscope. And this colposcopic investigation revealed two hazy fields on the front labium, yes, or anterior labium of the uterus, with a negative iodine test. Do you remember it mean negative when the tissues, it is Schiller probe, when we treated cervix with the help of a solution which contain iodine, yes, and if it is pathology, for example, dysplasia of the cervix, cancer of the cervix, leukoplakia of the cervix, these pieces on the cervix is not stained with iodine, and they become negative, they white. And from these parts, we need to take biopsy. What has this woman? She among this condition when we have any pathological fields on the surface of the cervix, yes, because iodine probe show us this, yes, this woman has calpitis, inflammation of the vagina due to presence of Trichomonas vaginalis, yes, yellowish discharges, but any our biopsy we cannot take, any surgical intervention we cannot do if the woman has inflammation. In this case, it is Trichomonas calpitis. That's why we need to treat this calpitis, and after this we take biopsy from the cervix, yes, biopsy of the tissues of the cervix. Diathermal coagulation, if we do with calpitis, it can cause spreading of the infection. Specific treatment of calpitis, it's not enough because we have other pathology on that cervix, yes, because something wrong with that cervix. Then cervixectomy at once we don't do because maybe possible more proper treatment for this, and cryolysis of the cervix of the uterus may be possible if but only after the treatment and after the biopsy. Yes, that's why first of all, we need to treat this calpitis and then take biopsy, and then maybe possible any treatment after the receiving of results of this biopsy. Now, if you want to remember the longest sentence, yes, here. Just about the pain in the lower part of the abdomen, fever up to 37.5, considerable mucopurulent discharges from the genital tract, painful urination, vaginal examination with speculas, urethra is infiltrated, cervix of the uterus hyperemic and erosive. Yes, I told you that usually it is the signs of inflammation. Uterus painful, ovaries are painful, thickened, fornixes are free. Bacterioscopy test reveals Diplococcus. Diplococcus, guys, it is what? If it is Diplococcus?
Gonorrhea.
Gonorrhea, Tkunya, you're quite right. It is gonorrhea. They don't tell you revealed gonorrhea. They tell you Diplococcus. For this, you need to know the specificities because microbe of gonorrhea looks like Diplococcus. What is the diagnosis is the most possible? Recent acute ascending gonorrhea. Trichomoniasis, no any signs in the test. No any word in the test about trichomonas. Candida mycosis, usually it is cheese-like discharges, itching, and usually antibiotic treatment in the history. Chronic gonorrhea, don't give us fever. Usually, chronic gonorrhea in most of cases give for us infertility. But we have mucopurulent discharges, painful urination, hyperemia, erosion, infiltration. All these are signs of acute gonorrhea, recent acute ascendant. And chlamydia don't give us, here there is no any word about chlamydia. Chlamydia very difficult to reveal, only with the help of PCA test, and usually what woman has, usually complaints on infertility sometimes at all. There is no symptoms. 25 years old patient complains of body temperature rise up to 37, pain in the bottom of her abdomen and vaginal discharges. 3 days ago, when she was in her 11th week of pregnancy, she had an artificial abortion. Objectively, cervix of the uterus clean, it means without pathological changes. Uterus is a little bit enlarged in size and painful. Appendages cannot be determined. Fornices are deep and painless. Vaginal discharges, sangia purulent. What is the most probable diagnosis? Here, what? No, here very easy to determine that it is post-abortion endometritis. In the history of the patient, she has what? Abortion, yes. And after 3 days, appear temperature and appear pain in the lower abdomen and vaginal discharges. What are the signs of endometritis? It is, I told you guys, somebody asked me, it is purulent discharges. You hear some purulent discharges. No, usually it is after abortion, but with pus, it is not usual. Yes, purulent discharges. And enlargement of the uterus and painful during palpation. Also, it is the signs of metroendometritis. Pelvic peritonitis, no signs which in this test. Post-abortion perforation, usually they gives you that it was perforation. Here, no perforation. And perforation gives us in most of cases bleeding, loss of consciousness, signs of hemorrhagic shock. Parametritis, no signs of parametritis. Parametritis can be possible after abortion when the infections spread from the uterine body to the tissues which surrounded, which located around the uterus. Yes, but here there is no signs of parametritis. Usually it is stone-like of the infiltrate, flattening of the fornixes, any marks in the fornixes of the vagina present, yes, and infiltrate which spread to the walls of the pelvic. It is parametritis. That's why Pretty came to us. Now I need to make screen again. The next, guys. Woman had the rise of temperature up to 39 on the first day after labor. The rupture of the membranes took place 36 hours before labor. The investigation of bacterial flora of the cervix of the uterus revealed hemocataretic streptococcus of group A. Uterus body soft, tender. Discharges are bloody mixed with pus. Specify the most probable postnatal complication. Temperature 39. It was labor. Yes. You see that it was very prolonged dry period. A dry period of labor, it means what? When amniotic fluid escape and labor continues without the amniotic sac, yes, without amniotic fluid. And this period is very prolonged, 36 hours. Very often it can cause the development of the infection. It is the reason of the infection, and first of all of metroendometritis. That's why dry period, high temperature, flora, hemocataretic streptococcus, and uterus body soft, tender. Discharges bloody mixed with pus. It is all signs of metroendometritis. If it will be thrombophlebitis, they describe you that doctor during vaginal investigation palpated the veins, painful veins on the painful blends on the walls of the pelvic. Yes, infected hematoma usually present any tumor-like formation, which is painful during palpation. Infection of the urinary system, they gives you frequent urination, maybe, yes, edema of the urethra, maybe, but ostium of the urethra. Guys, excuse me, please. Так, я сейчас со студентами, буду скоро заканчивать, я тебе перезвоню, хорошо? Все, пока. Apostasis of the junctures after episiotomy, but there is no any sign of episiotomy. That's why, of course, it is metroendometritis, labor, high temperature, streptococcus, and soft uterus tender with discharges with pus. Yes, it is metroendometritis. Remember, guys, about it. Number 5. On the 5th day after labor, body temperature of the parturient suddenly rose up to 38.7. She complains about weakness, headache, abdominal pain, irritability. Objectively, normal BP, pulse, we have acceleration of the pulse, 92 per minute, temperature 38.7 increase. During bimanual examination, uterus enlarged up to 12 weeks of pregnancy. Dense, slightly painful on palpation. Cervical canal led into transverse fingers. Discharges moderate turbid with full smell. No, uterus dense, I surprise. Usually it is soft consistent of the uterus if we speak about the metroendometritis. Painful, yes, moderate full smell discharges, and in blood leukocytosis, they mean. Leukocytosis, lymphoria, erythrocyte speed rate 30, yes. What is the most probable diagnosis? It is also the signs of metroendometritis. Again, they give you, but guys, how you understand lochiometra? What does it mean, lochiometra? In KROK test, in fresh KROK test present to this question. What does it mean? Who know? What does it mean, lochiometra? Guys?
The accumulation of lochia, it's not able to pass.
Yes, discharges after labor we name lochias. Yes, uterus contracted, decrease in size. From what discharges? From the place where was placenta. Yes, and discharges present prolonged usually 1 month. Yes, but especially they are very intensive in first days after labor. And if we have the spasm of the cervical os, sometimes this you are quite right, Kunya. These discharges accumulated, lochias accumulated in the uterus and cause development of lochiometra. Maybe temperature sometimes, maybe painful discharges, but usually we have the spasm of the cervical os. Here you see cervical canal leads to transverse fingers. Cervical canal is open. That's why there is no any obstacle for outflow of these discharges. That's why it cannot be lochiometra. Yes, it is endometritis. Yes, thrombophlebitis. I told you, usually they describe the veins which palpated the doctor on the surface of the uterus. Pelvic at all, it is another clinical picture. Parametritis also, there is no any symptoms of parametritis. That's why it is endometritis. To my mind, this test present 2 years when he suggested to lochiometra. This present in your KROK test. Examination of placenta revealed defect. An obstetrician performed manual investigation of the uterine cavity and uterine message. Prophylactic of, guys, we have 9 minutes and then we will finish our classes for today. Enough. Prophylaxis of endometriosis in the postpartum period should involve following actions: antibacterial therapy, instrumental revision, hemostatic therapy, contracting agents, intrauterine instillation of dioxin. All this may be possible, but first of all, in order to perform prophylaxis of endometritis after the uterine investigation, of course, we indicated antibacterial therapy. Instrumental revision, no sense. We have another indications for this operation. Hemostatic therapy, there is no bleeding. Yes, contracting agents also we use if it is bleeding. If we have, there is no here any science. Dioxin, usually we use during cesarean section. We introduce it after removal of the placenta, maybe possible introduction of dioxin, but here no any sense in this installation. The next, a 28 years old patient has been admitted to the gynecological department 3 days after the casual coitus. She complains about pain in her lower abdomen and during urination, profuse purulent discharges from the vagina, body temperature rise up to 37.8. Patient was diagnosed with acute bilateral adnexitis, bilateral on both sides, yes, both sides of the uterus adnexitis, inflammation of what? Of salpinx together with the fallopian tubes. Supplemental examination revealed the third degree of purity of the vaginal secretion, leukocyte with the whole visual field, leukocytes in all area of vision. Diplococcal bacteria located both intra and extracellularly. What is the etiology of acute adnexitis in this patient? No, very easy to answer. I even don't ask you to tell me about it. It is Diplococcus, and very quickly appear the clinical picture. Usually, I told you there's that latent period of Diplococcus, it is from 3 to 7 days. Very quickly appear the symptoms. Of course, it is gonorrhea. Number 8. On the 5th day after casual sexual contact, it's the almost the same test. A 25 years old female patient consulted a doctor about purulent discharges from the genital tract and itching. Vaginal examination showed that vaginal part of the uterine cervix was hyperemic and edematic. There was an erosive area around the external orifice of the uterus. There were mucopurulent profuse discharges from the cervical canal. Uterine body and appendages exhibited no changes. Bacterioscopic examination revealed B-shaped diplococci that became red after gram staining. What is the most likely diagnosis? Again, diplococci, again, casual sexual contact, purulent discharges from the genital tract, usually present itching, very rare, I want to say, painful, unpleasant, maybe frequent urination. No, here acute gonorrheal endocervicitis. They suggested you to set the diagnosis. Why endocervicitis? Because erosion around the external orifice was present, and we have hyperemia around the cervix. That's why it is endogonorrheal endocervicitis. Chlamydial, no any word about chlamydia present here. Then bacterial vaginism, guys, can cause by opportunistic microflora. Do you remember vaginosis? It is present of cloud cells. It is pH more than 4.5, and it is fish odor. In this case, it is bacterial vaginism. Number 9. 30 years old female patient has been delivered to the gynecological department with complaints of acute pain in the lower abdomen and body temperature 38.8. In history, sexual life out of wedlock and 2 artificial abortions. Sexual life is free, yeah? Gynecological examination reveals no changes of uterine. The appendages enlarge and painful on both sides. Vaginal discharges are purulent and profuse. What studies required to confirm a diagnosis? And to my mind, we have this test in other options in other topics: bacteriological and bacterioscopic analysis, hysteroscopy, curettage of the uterine cavity, or colposcopy. Of course, I told you, do you remember that if we have the signs of inflammation, it is purulent discharges, high temperature, we never perform invasive method of investigation such as curettage, such as hysteroscopy, because in this case we promote the spreading of the infection. First of all, we need to treat infection, and for this we need to know what microbes cause this infection. That's why, first of all, we perform bacteriological and bacterioscopic analysis, then indicated treatment. Colposcopic investigation cannot give us anything. No, maybe we can see the signs of inflammation of the cervix, for example, but here we have what? Increase of appendages, these organs inside the small pelvis. That's why colposcopy can give us only what? Condition can give us information about the condition of the mucosa of the vagina and vaginal part of the cervix. But here we have affected appendages. That's why in this case, no sense in this colposcopic investigation. That's why bacteriological and bacterioscopic analysis. Так, excuse me, where is our test? Mm. 25 years old woman. We have 2 minutes, guys. Complain of profuse foamy vaginal discharges, full burning and itching in genital region. She has been ill for a week. Extramarital sexual life without marriage, yes, without. On examination, hyperemia of the vaginal mucosa, bleeding, touching, foamy like area, frothy, foamy in the uterine area. What is the most probable diagnosis? Of course, foamy, frothy, it is trichomona, guys. I don't look in other options. They give you foamy, it is a keyword for this test. 28 years old patient complains of discomfort, acute pain in the lower third of the left labia major. Disease begins suddenly after menstruation. Objectively, body temperature 38, left labia has formation to 3 centimeters with hyperemic surface, extremely painful to the touch with symptoms of fluctuation. What is the most likely diagnosis? Yes, it is acute Bartholinitis, guys. Cancer, no signs. Fibroid, no. Usually it is dense. Cancer looks like as a ulcer or tumor-like formation. Here we have high temperature. Here we have sudden beginning of the disease, acute pain, complaints of discomfort. Yes, then Bartholin gland cyst. With this, we need to pay to this attention, and acute Bartholinitis. But Bartholin gland cyst don't give us temperature, mobile, and very rare painful. But acute Bartholinitis, it is painful formation. That's why we choose acute Bartholinitis. And maybe it will be the last test, guys. 21st years old female patient consulted gynecologist about itching, burning, watery vaginal discharges with fish-like smell. Speculum examination revealed cervical mucosa was normal pink color. Vaginal examination revealed no alteration of the uterus. Gram stain smears included, guys, clute cells, about which I told you, bacterial vaginosis or Gardnerellosis. But to this time, it's not right. Not only Gardnerellas cause bacterial vaginosis. They are present other microbes, Atopobium vagina, Snatia, Mabillun, Huson, Megasphaera, a lot of microbes. That's why bacterial vaginosis, clute cells, fish odor. Remember, it is vaginosis. Usually, sometimes they ask you about the treatment, and it is Dalacin may be possible in this case. Metronidazole